After COVID, my practice has really changed significantly. Like I'm seeing a lot more conditions that are related to pain and headaches are one of them. Even at work, between my nurse practitioners, between nurses, staff, I mean, I can see that a lot of them suffer from headaches because they're taking on so much in their life. It's not just work, it's work-life stress balance. And for the most part, in the medical field, they're taking care of patients in the hospital, then they're taking care of family members, taking care of kids, taking care of the house. And that becomes a huge overtaking. And headaches is one of those symptoms we see, which interferes again with those pillars of sleep deprivation, not exercising, focusing a lot of their energy on family and other things that they can't control for the most part, but not making time for their own health, their own emotional health, their own physical health. They are just being pulled in life and their stressors. And it's very difficult because I can give them medications. It helps for the time being. Unfortunately, I see that they're struggling from chronic headaches. I see that they're suffering from chronic migraines. And it's just more than just giving a medication. I changed the way I practice medicine. I'm not the traditional neurologist that's going to prescribe medication and run out the door. My patients are humans. They're patients that I would like to relate to. They're patients that I would like to treat. And they're patients that, I like to get to know. One of the jobs of a neurologist or physician is to educate. I need to educate my patients. So if I educate my patients, then they'll become more consciously aware of why they're feeling a certain way and also understand why they're getting headaches and migraines. So patients that are having increased frequency of headaches and headaches that are disabling, I like to tell them, this is why and this is what we need to do in order for you to get better. The medications are there for prevention or for rescue therapy. That's part of it. Then you got to layer all the other things, which is number one, emotional health regulation, habits. Number two is looking at their food intake and what they're putting in and looking at their inflammation. So people that are just not eating correctly are putting inflammatory fuel, which increases the risk of getting a headache. A diary is something that my patients can use, and they can look to see whether there's specific triggers. Nutrition plays a role because certain foods can trigger inflammation. So let me get into a few things that are important in diet. Dairy is a no-no. Dairy is just very inflammatory to the gut, and there is a definitely brain-gut connection. Some patients really feel that gluten-free diet reduces inflammation. If you're gluten sensitive and diagnosed with gluten sensitivity, then there's a likelihood. Just taking away all gluten does not mean that you're not going to get headaches. And it's also very difficult to follow a gluten-free diet. When it comes to diets, you want something sustainable and something enjoyable, because you want to enjoy your diet. So you want to enjoy eating all the foods. You don't want to restrict yourself. You don't want to starve yourself. I mean, what kind of life is that, starving yourself? So you want to put fuel in there that's anti-inflammatory and healthy. And eating healthy actually reduces your inflammation. There's an elimination diet, which patients can say, look, certain fruits or certain vegetables or certain alcohols can trigger my migraine. So let's eliminate this class of foods. So elimination diet is okay if you can find that specific trigger. The other one is keto. So keto is a diet where you restrict yourself of carbs. You put yourself and you shift your metabolism into a fasting state. Small studies that show that keto diet can reduce the amount of headaches. The problem is that something sustainable? Can you be on keto for a long, long time? Keto, maybe with intermittent fasting, is something that was suggested. The only problem with intermittent fasting is that sometimes fasting in itself can be associated with headaches. So patients that skip meals or miss meals, or they are habitually eat a certain time, that can trigger migraines. So skipping meals is a double-edged sword if you're intermittent fasting. So pay attention to if you do intermittent fasting, whether your headaches have increased in frequency. Another is low-glycemic diet, which is somewhat a healthy diet, keeping your sugar levels low. Again, you can get irritable when your sugars are low. Your dopamine levels for cravings can increase. So there you can trigger maladaptive habits. So pay attention to a low-glycemic diet. And the big diet that I am a big believer of is the omega-3s. The omega-3s, keeping them high reduces inflammation. It's extremely healthy diet. It's olive oil-based diets. It's salmon. There's certain fishes like mackerel, white fishes cooked with olive oil as opposed to vegetable oil. Vegetable oils that are in processed food is a big trigger of headaches. Canolas can have a high omega-6. So you want to have a higher omega-3 to omega-6 ratio because there can be a crossover. Like peanut butter can actually have a high omega-6 value, but if you're having the fresh, natural peanut butter, it's very different. But if it's cooked in those oils, it can have a higher omega-6. The migraine diet that is most beneficial at this point that we're promoting is a non-inflammatory or decreased inflammation with omega-3. The other thing is sleep patterns, looking if they're getting headaches during sleep, are they getting headaches when they're sleep deprived? Do they suffer from insomnia? And then exercise, putting exercise into a program and a regimen. But that's not just exercise. It's moving. It's also stretching, yoga, Pilates. I mean, there's certain exercises that releases tension and contraction, stretching your back muscles, your neck muscles, because patients that have migraine also could be suffering from a lot of neck pain, back pain, jaw pain, very muscular pain. So adding the layer of stretching and meditation and breathing, which is important, breathing itself and learning how to breathe correctly, like diaphragmatic breathing, relaxes the muscles. Sometimes over strenuous exercises can produce migraines. So you have to see what's triggering your migraines. If you're doing like a HIIT workout, and that's too much and you're getting your heart rate and getting headaches afterwards, then I would limit that type of workout. But just exercising itself, you got to see what program works for you the best. So exercise is important. And then what type of exercise? Well, there's walking, which is a good brisk walk, getting your heart rate up to a certain level. Believe it or not, if you increased your walking time and you calculate your heart rate, there's actually a burning zone of heart rate that occurs that you're just burning fat and not burning muscle. When you're in a tense state, your muscles are contracting or fight or flighting. Doing something called progressive muscle relaxation, which is a technique where you kind of contract your muscles, relax, contract, relax. That helps you actually sleep better as well. And then the yoga or stretching also, those are ways to reduce the amount of contraction. That's why like myofascial pain syndromes that patients are being diagnosed with, or fibromyalgia, the muscles are contracted. These myofascial pain it's pain, but we want to focus on releasing that with certain exercises and stretching. Also, releasing tension and stress through endorphins, through exercise is a great thing. It makes you less irritable, makes your mood a little better, makes you less sensitized. Another thing people can do is cold therapy or cold plunging. Believe it or not, the whole cold plunge and the ice itself is also a release of these sympathetic, even adrenaline. And that releases these chemicals that actually also can change mood and your behavior throughout the day. And exercise itself, whether it's cold plunging in addition to working out and exercise itself, not only help you become less sensitized and help your mood, it's also going to help you sleep better. Studies show that exercise routine pattern improves sleep, as long as exercise is not done too late at night. Because if you increase your heart rate, and some people, if they exercise too late at night, it will interfere with their ability to regulate and sleep well at night. As you can see, migraines are very complicated. It's not just a medication and they're going to feel better just like that. It's so complicated if you don't hit all those pillars. And so it's not so easy to really, with one visit in a short period of time, help a patient with migraine. It's very complicated. You have to peel all the layers. That's where I decided at one point when my patients were not feeling better or not healing, is to get in there, peel those layers, make those connections, and spend enough quality time to teach my patients all those pillars and make that conscious connection of why they're not feeling well, why they're suffering from migraines. And that is the step for recovery.